everybody. Good evening. It is me, Dr. Renee, and we are back again. BlackDoctor.org, of course. So, in case you guys hadn't noticed, today is February 10th, 2022. And so, February, besides the fact that Valentine's Day is next week, but February is known as Heart Month. Last Friday was Go Red Day. So, today we're going to talk about the heart. And I'm really excited because we're going to cover a few things in the heart. My guest has a very, very, very special story and the way that she's helping people with their heart health. And I know she could help many of you. So right now I need you to, one, type in the comments and tell me where you're watching us from. And two, I need you to share. So we're on Facebook, we're on YouTube. Please, please, please share, because I know for a fact that you know somebody who has high blood pressure or diabetes, or they are somebody who has some other heart ailment. And so I need you to please let them know to watch because we're trying to save lives today. And I hope that I know you're going to get something from this. So please tune in. We're going to get right into it because I don't wait. Good evening, Dr. Toomer.
Hello.
Thank you so much for joining me tonight. I really appreciate your time. And I know that you are going to touch somebody tonight because when I read your story, I thought it was pretty interesting. And I'm so glad that you're still with us. Praise the Lord. So can you please tell us your heart story?
Well, when I was 36 years old, which was 20 years ago, over the years, and I'll just give a little backstory. I had was never a small person. I'm never thin, really, but I just slowly gained weight over years and years and years. Most of it stress weight from school, from med school, from residency, from marriage, and all the
We
rest,
have
and
a lot
having
in
one
common.
baby. and then I had a baby and never lost that baby weight. And then I had my second child within 3 years of my first. And at that point, I was morbidly obese. My BMI was over 41, which, again, we'll talk a little bit about how BMI is not
Yeah.
really a good measure for us, especially. But it just kind of gives an idea of where I was. I was over 200 pounds and I'm only 5 feet tall. And so, and then a month after my daughter was born, I was diagnosed with congestive heart failure related to the pregnancy. It's very rare. There's a high mortality rate with the diagnosis. I knew this because I had actually lost a patient to the same diagnosis when I was a resident. And so I was terrified and very overwhelmed. I was tired just from my diagnosis. I could barely move, I could barely breathe, and I didn't know what to do.
So
And
wait. So let me stop you there. So you
all
had a
right,
baby and then were diagnosed with congestive heart failure.
yes,
So, first of all, you have a newborn. So I know
and a
healthy human
toddler.
beings that have babies that are
Hmm.
beyond overwhelmed and,
Yes,
can't get so you have this diagnosis on top of having to take care of a new baby?
yes, and a toddler.
Oh, and I forgot.
Who,
And you had another one
yeah, I
already
had a
there.
2.5 year old who was very active and always asking questions. Mommy, why can't you do this? I mean, I couldn't walk and hold my baby at the same time.
Oh my
I had to choose which one I was going
wow.
to do. So if she started to cry, I could not jump up out of bed, walk to her, and then pick her up because I would be too winded and out of breath.
Oh
And
my
so,
goodness. So
yeah,
wait,
and I
so
couldn't.
let me
Yeah.
just ask this question. Were you somebody
Hmm.
that, because I have spoken very openly about my weight loss on here and I've said
Hmm.
how I literally, and I don't know if I even told you this, but I literally couldn't walk to the bathroom in my 640 square foot apartment without my
Hmm.
back hurting. And
Yeah.
that is one of the things that stopped me in my tracks was like, you got to do better. I only lived on the fourth floor of my high rise. My high rise has 19 floors.
Hmm.
I only lived on the fourth floor. So even the times when the elevator was out, it wasn't like I was climbing, 10 flights or anything. But those
Hmm.
four, especially on top of the fact that I have asthma, were no joke.
Yeah.
Now it's nothing, thank God, but it
Hmm.
was awful. But I
Yeah.
cannot imagine not being able to pick up your child and you heard them
Hmm.
crying. You get to them and you
Yeah.
just
Yeah.
out of breath.
Congestive heart failure causes such shortness of breath, especially mine was very severe. At the time, at the first month, I didn't even realize that's what it was. I kept saying, telling my doctors, I'm really short of breath. This is a little bit more than usual. I'm a little bit more swollen than usual. And then I did eventually go see someone, and I was diagnosed with pneumonia.
Oh,
Um, yeah, because I had a fever. However, with congestive heart failure, with postpartum cardiomyopathy, endocarditis, which is the inflammation and infection of the lining of the heart, can also happen at the same time, and that causes a fever. So the fever sort of threw everybody off and thought, you can't breathe, your lungs sound horrible, and you have a fever, it's pneumonia. But I still couldn't do anything. But I was just terrified. I mean, it was to the point I couldn't lie down and sleep. I had to sleep sitting up.
mhm.
I would fall asleep scared, wondering if I was going to wake back up.
Wow.
I did not think I was going to survive it,
Now,
even
I
knowing it
mean,
was.
so you said you were, a heavier person, but did you? Because in residency, I will never forget. One, we're short people. I'm
Mhm,
4'11". I mean, I remember trying to keep up with the doctors when I was a med student. I was like, dear God, one of their strides is
mhm,
like 10 of mine. So I was like,
yeah.
so were you able to keep up then? Like, did you ever experience
Mhm.
shortness of breath of like this then?
I only experienced a little bit of shortness of breath like that when I was pregnant with my daughter. I was in my third year of residency when I had my first daughter.
Okay.
And so then I did feel it, but I would just don't slow down. I was a senior resident at that point. I was like, look, I was like, I'm going to start referring patients right now. So you got to be nice to me,
Right, right, right.
so, but, but at that time, I knew that my weight was giving my heart just too much to do. And I was finally diagnosed. And the way I was diagnosed, I was actually, my husband was out of town. I was at my in-laws who lived a few miles away, and I couldn't use the bathroom. I couldn't produce enough pressure to urinate because I could not. You don't realize how much you use your lungs until you just can't use them. That's
I
how
say
short
that
of breath
about a
I
lot of
was.
things. I
Hmm.
had I had something wrong with my foot, my big
Yeah,
toe, and I couldn't step on it. And I said, "You don't know how much you need it until you can't
until
use the
until it's
thing."
gone. Exactly. And so that's when I woke them up. It was in the middle of the night. I woke them up. We got an ambulance. They got me to the hospital. And at that point, they took an x ray, and my lungs were just completely whited out. I was still breastfeeding, had never used formula. My first daughter breastfed until she stopped, had never used formula, never drank milk, never used a bottle. So I didn't even have bottles for my daughter.
Oh God!
And
And now you're a
suddenly,
patient in the hospital,
in the hospital, I was
and your
sitting in the
husband's on
emergency
vacation. I
room.
mean, your husband's out of town.
He was away because he was out of town preparing for his radiology boards. And so I was in the hospital, unable to breathe, breastfeeding my daughter because we didn't have formula for her. While they're doing the test, they had to hold her while they did the X-ray, brought
Oh
her
my
back to me so I could
God!
burst her again. And I'm crying because I'm just scared, and my oxygen level was so low, so my brain wasn't functioning properly, and so I was just terrified. She was screaming, and then they would take her, and she'd start screaming, and then like they're trying to give her form. It was just, my husband was gone, so we were trying to get a hold of him.
Right.
Fortunately, it was in a hospital where I had privileges, so people knew me, so I had a lot of support of people who were there. But I did not think I was going to live. I knew enough. I could. They put the X-ray up in front of me, and when I looked at it, I was like, "That's it. I'm not surviving this."
Wow,
Um,
that is crazy.
And so then when they did the echocardiogram to just see exactly how much my heart was working, my ejection fraction was 15%. And for
So tell
anyone who
everyone what
knows,
exactly that means.
usually, okay, so ejection fraction is pretty much your heart pumps blood, it fills, then pumps, then fills, then pumps. Generally, when your heart fills with blood and it pumps, it usually pumps out about 55 to 65% of what it fills. And so it's called the ejection fraction. Mine was at 15, so my heart was filling, but only 15% of what it was filling with was coming out. And so that's why it's called congestive heart failure, because my heart was failing and that liquid was congesting my lungs, was going into my lungs, and then it goes into your liver,
Mhm.
and that causes another set of problems. Um, and I knew all this. I couldn't turn my brain off,
Of
but
course
I
not.
couldn't use my brain to help myself. It was just a bad situation. And so, and then they had to give me medicine that I couldn't breastfeed. So I had, and we didn't have formula. We didn't even know she wouldn't take a bottle. So, and I didn't have a pump. I didn't have anything. I mean, she was only a month out. And I was on maternity leave. So I didn't even I had 2 more months before I had to start pumping and putting stuff away, you know? Um, and so it was a mess. It was just an absolute mess. So she had to be in the room with me. Even though I couldn't feed her, they had to keep her with me just so I could soothe her because she would just cry and cry and cry. They couldn't take her to
Yeah.
the nursery. My husband wasn't there. My in-laws were with my toddler.
Right. I was like, they need to
The,
take care of the other one.
so and she's wondering, where's my baby sister? Because as far as she was concerned, that was her baby, not mine. So she was
I
like, "Why
have a
are you
little
taking my
sister. I
baby in an
understand.
ambulance?"
Right. I have a little sister. I understand.
Yes. And so it was, but when I got out, I knew enough to know that anyone with heart disease, there's a very much of connection between heart disease and depression. In fact, I was always trained that if someone has heart disease, if they're diagnosed, you automatically start treating for depression, either with medication, counseling, or both. And so, but the problem with depression is that it zaps you of motivation. And so all the things I knew I had to do to get better, I was so depressed. I had postpartum depression. I had diagnosis depression. I had cardiac depression. And I was still recovering from residency. So I had mild chronic depression because I was
Right.
only a year out of residency. And I
You
shut
were
down.
just completely paralyzed.
I
Like
just
I just can't
completely
do
shut
anything.
down. And so what I did is I decided, okay, well, I'll get help from someone else. I'll have them help me lose weight, and I was an insulin dependent diabetic at the time. I forgot to mention that. Yeah,
Is everyone listening? Okay.
I was on insulin and a
And wait, you
diabetic.
were type 2 then, right?
Yes,
Okay.
it was a combination of my obesity. It started with my obesity and then exacerbated by the pregnancy.
Got it.
And so, because of the pregnancy, I was on insulin because usually that's the only medication you can take for diabetes when
Right.
pregnant. So, I hadn't yet gotten off it to go on to something else. And so, when I tried to get my diabetes under control, I went to the endocrinologist. They're like, we're not touching you. You stay on your insulin until your heart gets better.
Mhm.
So, I'm like, okay, well, then let me try to lose weight. So, I went to some of the more popular programs, and they're like, you're too high risk. We're not touching you. And I thought, wait a minute, how can your program be so unhealthy that you can't help me because I'm high risk? That doesn't
Wait,
make sense.
so let me ask because I honestly have never called any of these places.
Hmm.
So medical weight loss, isn't there a physician that's in charge of those things? Okay, so that was my point because I didn't know. That's why I was like, let me ask because I know because
Yeah.
I currently it's no secret I do Weight Watchers. I know Weight Watchers has nothing to do with medicine and does I mean not
Hmm.
medically, it doesn't
But to
have
be
a
honest, Weight
doctor.
Watchers turned me. My local Weight Watchers turned me away also
Okay, okay.
because they're just like
Well, that's what I'm saying. But that's why I
yeah,
was saying medical weight loss. I always
yeah,
felt like that's the place I should call because
yes, exactly. Well, you have to also understand this was 20 years ago. A lot of
right,
things have changed in a lot of these places.
right.
Even Weight Watchers has changed a lot,
It's
given
phenomenal.
what they
But
do.
yeah,
And so what happened? So then I of course was already depressed and getting worse because I was then hopeless, helpless, and I was just
you can't find anyone
and
to help you.
overwhelmed. And then I was like, you know what, Catherine, get it together. You're a doctor. You can do this. You've helped so many of your patients through this. You can get yourself through it. And I thought, I was trained in what's called a biopsychosocial system. So I'm like, you know what to do. Focus on your biology, focus on your psychology, focus on the sociology of all of this. You know what to do. And I said, what's your number one issue? Because I'm looking at my babies and I just couldn't bring myself to do anything. And I was like, if your babies can't get you motivated, what is the true issue? And I was like, it was my depression. And so I was like, treat your depression first. Let's get your depression under control. And then let's see what happens. And as soon as I did that, it just so happened that my favorite antidepressant that I've used with all of my patients at that time was just an antidepressant. Now it's
Wow.
actually used in a weight loss medication. And the reason I chose it is because it acts quickly. There are few side effects. There's no withdrawal if you stop it. And so, whereas many antidepressants take 4 to 6 weeks to get started, this one starts working immediately. So I'm like, I need something now. I was so afraid of getting worse
Right.
because postpartum depression can really mess with your head even more than regular depression.
Right. And it could turn into
You know,
psychosis. And that's, we've
yeah,
heard of these people.
exactly.
There
They'd
was a
be better
woman in
off without
Chicago that
me.
jumped out of a hotel building.
Well, a month before my daughter was born, someone in Charleston, South Carolina, near where I live, did the same. A physician. She was a physician, and postpartum depression. So I was scared. I was just like, you might go down that path if we don't get this under control, because I was already having thoughts that they'd be better off without me. Not only am I depressed, I'm sick. I can't do anything. My husband had to help me bathe. He had to do all the cooking. He couldn't, everyone else had to take care of my baby because I couldn't do it. And my whole identity around motherhood, especially at that time, at that stage, was breastfeeding, and I couldn't
Right.
do it. And so but I was like, so I just basically chose an antidepressant that I couldn't even actually get my doctor to prescribe. So I actually prescribed it for myself. Fortunately, it's legal, so I was able to do that. And so I prescribed it, started taking it, and immediately started getting better. Suddenly, my outlook changed. My mindset shifted. Of course, now we know mindset's very much of a part of wellness. Then nobody was talking about mindset. And so took my antidepressant, started getting motivated, and then started creating my own program. I would I said, okay, I'm going to get my diabetes under control. One of the beautiful things about diabetes is that it is meal related.
Hmm.
It takes one meal to get your diabetes under control. And so, having not being able to cook, and my husband was like, "We're getting you well," so he did the cooking. And so I started paying attention. How much could I eat? What could I eat? Because I'm not. One of the things I learned very quickly, I don't have a lot of willpower and discipline around food. I just don't. I like
No,
my
but I
food.
always tell everyone, you got to know you. And if
And I
you
like
you
food.
don't know you, then that's a problem. You need to know what works for you and what does not work for you. I know there's
Exactly.
certain things I'm not going to say no to, and there's certain
Yep.
things that I can say, well, I don't like. You could bring 10 cakes in front of me right now, and I promise you I would not take a slice of any of them.
Mm-hmm.
But other
Yeah.
people, that would be a problem for them. But that's not a problem for
Mm-hmm.
me. But
Yeah.
then if you put, the best snickerdoodles on the planet in front of me, I am a cookie monster. I'm going to eat cookies.
That's me. Oreos. Well, actually, it's anything sweet. I have a sweet tooth.
And I
I
don't have a
just do.
sweet tooth. So
I
I'm very
do.
particular. It has to be certain
Mm-hmm.
things. Like you could
Certain
put all the
things.
candy in the world and I'm not going to touch it. But,
Yeah.
certain things. So you have to, that's good that you knew.
Yeah. Well, I'm one of those people. I like everything except what I'm allergic to. So, and even the things I'm allergic to, I still look at people eating it thinking, man, I wish I could eat that. I
Okay,
love
so
food.
all
I
the
just
things
like
I'm
food.
allergic to, because I've never had them, I have no, like, I don't.
Well, I haven't had them either. I
Really?
just like the way they smell. I like the way they look. They just look like something that's
Because
like I can't
I
eat
can't have
shrimp.
chocolate and I've never eaten it, but I've never sat
Yeah.
there and been like, no, it's
Well,
never.
see, I'm allergic to seafood.
I am too.
So I see people eating shrimp and I see people eating
Maybe
fish.
the way it looks, it did not, it doesn't
It
appeal to me.
smells good to me anyway. So what would happen though is that I learned that very quickly. So what I started doing was saying, the only thing that gave me pleasure, the only thing that made me feel good was sitting down with my family and eating. So I'm like, I'm not going to stop doing this. So I started documenting my blood sugars after eating certain things. And I just kept really meticulous records of what made my blood sugar go up, what didn't. When it made my blood sugar go up, I was like, well, maybe if I just reduce a little bit of this and increase a little bit of that, maybe it will work. It started to work. And so I documented that. And within 6 months, I had lost 60 pounds. And suddenly I was off insulin at that point because my blood sugars were normalized. The beautiful thing about diabetes control is that when it's more controlled, your weight comes down. And when your weight comes down, your diabetes becomes more controlled. So it was a nice cycle of improvement for me. And high blood sugars also affected moods. So when my blood sugar started coming down, my depression started coming down as well. And so it was just this nice combination, this nice stew of events that just got me feeling better. And I was then able to focus on my heart and getting better from that. And when I started cardiac rehab at that time, I couldn't walk on a treadmill for a minute.
Mm.
I had to stop because my heart rate would jump up too high. Within a year, I was able to walk 10 minutes. Even though my weight had come down, I was still feeling the effects of the congestive heart failure. A year ago, I'm 56 years old now. I'll be 57 in August. I
August
walked
what?
for August 26th.
You're a Virgo too. We have a lot in
Yeah.
I'm August 3rd.
So but anyway, I went through cardiac rehab again recently. I do that every couple of years just to kind of keep me doing well. But I was easily walking 4 or 5 miles a day, not even thinking about it.
Awesome.
And I was told I had a 50% chance of living 5 years. And I'm here now 20 years later. And I know my weight loss saved my life. I know it.
Hmm.
It just did.
Now your
But one
heart
of
is what are they saying about your heart now?
well, I still have congestive heart failure. I still have it. But because two things, my attitude keeps me well. My cardiologist has always said, you'll know you're well when you forget. And I forget all the time. I'll run up a flight of stairs, not even thinking about it. I'm like, whew, I'm a little winded. I'm like, what? Oh, because you just ran upstairs and you got congestive heart failure, girl. That's why. But I forget, or I'll pick up something really heavy. I'll do so, and I just live normally. And unless something stops me in my tracks, I just do what I do. And so, but my attitude and my weight loss,
Hmm.
I'm right now. Even though weight is important, but I right now I am about 3 to 4 pounds away from where I was in high school. And as a result of that, my body just doesn't, my heart doesn't have to work as much.
Right.
My joints don't have to work as much. I still eat food. I love food and I eat it. I just am very careful about how I eat it. But I don't deny myself anything because food's too much of a joy. I like it. That's one of my joys of life. So I
That's what
continue to
I
do
tell
that.
everyone. Like I was like,
You
I've
know?
seen all of these and heard all these
Yeah.
elimination diets, and I was like,
Mm-mm.
funny. I eat everything I want to eat. Yesterday was National Pizza Day.
Mm-hmm.
I don't know if everyone knew, but we had pizza over
No.
here. And it
Okay.
was delicious. And no, I
Yeah.
didn't have cauliflower crust pizza.
No.
I had a piece of Jets cheese pizza, and it was delicious.
Yeah.
Because I eat what I want to eat. Now I tell people though
Yeah.
I work out so I can eat what I want to eat. But
Yes. And not only that, but the way you feel, the how you eat and the way you eat and what you're feeling when you eat changes what your body does with food. If you're eating
I
out of
literally
guilt,
watched I forgot what it was, something, and it was a whole thing about how you're supposed to have a certain mindset when you put the food
you're
in your mouth and
eating.
stuff. And of
Yes.
course, at the time, I was really fat, and I was just like, "Oh my god, this has got to be some craziness." But I was
No.
desperate. I was like, "I need to try everything I can." But I think that it's funny you say that because I weigh myself every
Mm-hmm.
single day, and
Mm-hmm.
I always think, I used to think, oh, well, I had, KFC yesterday. And when I get on the scale in the morning, oh my God. But it's never like
Yeah.
that. I'm just
Well,
like,
and then even if it is, usually it's the salt, not the food. So,
right. And
and that's
I drink a
something,
gallon of water a day, so
water
I
a
don't need
day. So
we
that's,
usually
and
get
then, well,
that salt right on out.
yeah, well, see, for me, one, I couldn't exercise at the time I was losing my weight because
Right.
of my heart, and I couldn't drink a lot of water either because of
Hmm.
my heart. One of the uh, recommendations when you have congestive heart failure is to limit your water intake because your heart can't pump that volume. You have blood volume, so you have to reduce it. So all those things came into play, but I realized for me it was simply getting my blood sugars under control, and that's what did it. And realizing that I could. The biggest hurdle for me was just fear that I was going to fail. I was like, yes, this is working, but what happens if it stops? What am I going to do then? And so, but it just didn't stop, and it kept going. And I was
I
fortunate.
think that somewhere along the line, somewhere in 2021, I was like, this is a fluke. Like, this is kind of weird because I haven't been this
Mm-hmm,
small in more years than I can count. I have my annual exam on the 22nd
mm-hmm,
of February. And if I play my cards right, I will be less than I weighed when I came into my OBGYN's office, into her practice when I was 17 years old, the week before I
mm-hmm.
started Michigan State.
Oh wow.
And it's
Yeah,
because I have the
and this
same
is
doctor.
what it is.
Yeah, so
And
this was
so what
I weighed
happens,
my
and
senior
that's
year of high school, basically.
yeah,
So I am just like, it blew me away because I just was like, the scale. Well, I always say numbers don't lie. So I was just like, is the scale for real? And because
yeah,
I haven't seen people in person because of this lovely pandemic, I just see my family who sees me daily. But they were like, but you didn't notice? I go, I guess I did it. And like today I looked in
yeah,
the mirror and was like, oh my God. Like I have no
mm-hmm,
rolls in my back. I was like, what
yeah.
is this? I
Well,
just,
with
in my
it's
shoulders,
but
I'm
that's
like, what is this?
psychology. But for some people, that's their pitfall, though. One of the things that I do, because this is to carry on my story. So what happened when I finally was able to go back into medicine? I realized that when I had because I'm a family medicine physician, and so what I realized was that I couldn't help my patients in the same way that I helped myself because I wasn't given time, I wasn't given the resources, and most of the places I worked were not inclined to provide what was necessary for me to do that because it takes a lot of time. And I worked with underserved populations because that was my calling, and it is my calling still. And so when I realized that I was just beating my head against a wall, and the stress of the job of that was actually making my heart deteriorate, so I was like, okay, I'm not going to kill myself over work. So what I ended up doing was just creating something for myself where I founded health, wellness, and weight loss centers where I could spend an hour with people. I could actually go through all of their biology, their psychology, and their sociology. I screened for everything. And so I was very adamant that whatever people did, it did not affect their family life. It didn't affect their marriage. It didn't affect their work life. It didn't affect their friendships because there's nothing sadder than sitting with your friends and they're all eating something and you're
And
sitting
you
there like,
can't have
I'm on
any.
a diet, I can't eat that. Or even worse, you don't even go out with them because you're sitting at home because you're like, I don't even want to be tempted, I don't want to go out because I can't eat what they're eating, I can't. And I just so the so what I did was I just like, you cannot do that. And so I created a program that fit into my life. And so essentially what I do now is just help people take it and fit it into theirs.
Did you all hear
Because
that? So if you need some help, one, we are at blackdoctor.org. She is looking to help people like us. Here's her website. I put it up on the screen.
oh, thank you.
And if your doctor, because a lot of people, there's a lot of us that are, oh, I don't want to take medicine. Oh, I don't want to take pills. But you guys realize that you do need this medication or else you need to do something else.
Mm-hmm.
And a lot of
Yeah.
people, one, they wait too late. There's a whole lot of us walking around with pre-diabetes
Or insulin
diagnosis,
resistance and don't even know it.
don't have a clue, or the doctor told you, but you didn't change anything. The next
Mm-hmm.
time you go, they are going to be forced to put you on something. So
Yes.
you have got to nip it in the bud now. There's a lot of
Mm-hmm.
people don't want to take blood. They don't want to take a water pill because I'm only
Mm-mm.
35. Why am I taking water pills? Because your BMI is 30 something, 40 something, and
Mm-hmm.
you about to have a stroke and die. You need to take a water pill.
Yeah.
So it is important that we nip it in the bud now. And like she
Mm-hmm.
said, she sits down with you. She takes all of your, all the blood work to get it all together to figure out exactly what is your story because your numbers
Yeah.
will not lie. So
No.
what is
And
your
we're going to talk
story?
about that too. But one of the things that's wonderful is that because of COVID, this is one of the best things to come out of COVID. Everything could be done electronically now.
Yep.
So one
So
of the
we can see
beautiful things is
faces all over the place.
I I closed my office because of COVID, but now I can help people around the world, and so I do. I mean, I have people that I work with in many, many different countries, and so. But what's really important to understand is that nobody's trying to kill you; they're trying to save your life.
Right.
And medication won't kill you, but not taking it can. And
And you know the
so
other
if
thing I hear
someone
people talk.
recommends it, it's not because they're trying to sell you something. We don't get anything from the pharmaceutical companies, no matter what anybody says. We don't get anything from them for
Sure do
prescribing
not.
medications. We just don't. And so what we are doing is trying to prevent you from having to take more medication later
And you know
because
the
it's
other thing
easier
is that
to
people like to
prevent.
say when you change your diet, it costs
Mm-hmm.
a lot of money to eat healthy. No, it costs more money to
Mm-mm.
be sick.
And it doesn't cost a lot of money to eat healthy
No,
anyway. I
not at
can
all.
take $5 to the dollar store and have enough meal for a family for 3 days because a bag of beans, a bag of rice, cans of vegetables do not cost a whole lot of money, and that's enough to make you. That's a healthy meal. There's a reason why beans and rice, beans and corn are combinations that you see around the world. The poorest people of the world eat mostly eat a healthier diet than we do, and they don't have much.
They don't have much.
So no, they don't have. It's really not difficult, and that's the other thing. But that's part of the social part. When people say, "Well, I don't have the money, I can't do this, I can't do that," we figure it out because that's part of what you have to do. You have to take care of the whole person. It can't just be one part. It has to be all of them and everything that they deal with. And so when people tell me, say, you're a weight loss doctor, and I'm like, yes and no. I'm like, I help people lose weight, but that weight can be in pounds or whatever in life is weighing them down. I help them lose both. And really, for health, it's not about the numbers on a scale
Oh,
necessarily
we're
as
having
it
an
is the
echo
amount
for
of
some
fat.
strange reason.
Oh, am I echoing now?
Okay, you're okay now. Go ahead.
Okay. So one of the things that I say is that not all weight loss is good weight loss. So it's really fat loss that we're looking for because you can lose muscle while you lose weight, and we don't want people to lose muscle. And the reason why you'll see that someone will lose weight and they can't keep it off and it comes right back is because they lost too much muscle during that process, and they didn't do it in a way so that they maintain their muscle mass. And so that's why weight is sort of, we use the word weight because people understand what that word is, but really what you're trying to do is lose fat because fat in your body causes inflammation. And, it's not about body shaming. It really isn't. And we should be healthy at any size. Doesn't matter what your size is because it's not about size. It's not about a number. It's about your health. And so if your numbers look good, if your blood pressure looks good, your blood sugars look good, and your thyroid's functioning like it's supposed to, and your cholesterol's fine, then all that is just let's get your inflammation down because if you're having inflammation, it's inflaming blood vessels of your heart as well. And so that's the reason. It's not to shame anyone. It's just to get people to a point where their body functions in the way that it's supposed to function. And there's no number attached to that. There's no weight attached to that. For every single person, it's different. But it's important to pay attention to those things. And so, um,
If there
and
are
so
any
that's
questions,
essentially.
please make sure you type them in the chat. But I wanted you to go back to the BMI and
Hmm.
explaining that.
Okay. So what the BMI is it is a number created from an equation that essentially creates a relationship between your weight and the mass of your body, the actual square inches, so how tall you are, your shape, and your weight are all combined in a way to give a number that kind of tells us where you are on a scale. Now, there have been studies that have shown that the higher that number, the more disease you see. And if the number's too low, you see different types of diseases. However, it's a number that doesn't work as well for us simply because we tend to be more muscular. And the more muscular you are, the higher your BMI. And so even though my weight is low, my BMI is actually higher than what you'd expect simply because I have a lot of muscle. That's genetically, we just have muscle. And so using that number isn't always a good idea for us. It can be used actually to discriminate in a lot of ways. And so what else ends up happening? You go to a doctor, your knees are hurting, you have a headache, or you're tired or something else. They look at your BMI and they say, okay, lose weight and all those symptoms will go away. Well, some might, but that's not the reason. You can't use the BMI to decide what someone should or should not do. And that's why I don't like to use it as much, just because it doesn't work for all of us.
Use it as a
However,
guide.
your symptoms will be your guide.
Oh,
And and so what's really important though is, if this is what I see a lot and used to see a lot, people would come to me and they'd want a pill to lose weight. And there are pills that will make you not eat, but any of us who've been overweight know we don't eat that much. It doesn't take a lot of food to keep your weight. I was never a big eater. I never my weight was not because I overate. It was because of stress and what my body did with food when I ate it. And my diabetes. It was what my body did with food when I ate it. And so dropping my appetite wouldn't do a whole lot of anything. But rather than take a pill to drop your appetite, why not take a pill to reverse your diabetes or to get your blood pressure under control? Um, or rather than take a pill, if someone recommends, ooh, excuse me, I thought I turned my ringer off of my phone. I apologize. Um, instead of taking a pill, or maybe take a yoga class,
mm-hmm.
learn
Mm-hmm.
meditation.
Or
But
walk around the block.
in the meantime, get your numbers to normal and then use something else to take over time. Don't let your body continue to get damaged while you're working on getting those things fixed, because it can take some time, and during that time your body's still suffering from the consequences of those events.
Yeah, definitely. Um, like I said, if you have any questions, please type them in the chat. But that is so, it's what she's doing is so helpful to so many people because, like she said, doctors do not have time. None of these healthcare systems that anyone works for gives you more than like 10 minutes with a patient, if that long. So you don't have time to find out exactly what is going on and what is the underlying problem. Because there's a whole lot of obese people that think I just like food. No, that's really
Yeah,
probably not it. you
yeah,
know, and then we do need food to survive. This is so true, but
yes.
you need to make better choices with your food. Someone said, is a continuously rising CRP level dangerous?
Okay. First, let me ask you, what do you mean by CRP? Because in medicine, there's lots of different acronyms for things. So before I
Okay, we'll
answer, I
wait
want to
for
know
them to
what
say.
you say CRP is.
Someone said, is there a quick change that can be made that isn't medication? Yes, your diet.
Yes. There's lots of changes,
Yeah.
actually. One is self care, boundaries. You be honest, one of the best ways of losing weight is setting boundaries for other people, setting boundaries for yourself, setting boundaries, because the easier you say no, the better you feel. The less your time is taken up by things that do not serve you. Just learning how to serve yourself really is the no, is the first thing, is the easiest thing to do. So I hear like some people will say, "How do I stop stress eating?"
Get rid of the
And they're
stress.
like, "I stress eat," and I always say, "Don't." Well, how do I stop emotional eating? Don't. We all eat out of emotion. We eat to celebrate. We eat. What's Thanksgiving? Thanksgiving meal is all an emotional eating day. And so what I always say is, don't worry about why you're eating, just change what you're eating. Why go through that whole thing? And now you can delve into that if it's a serious problem, if you're binge eating, or if you're not eating, becoming anorexic. Of course, those relationships to food have to be treated and have to be investigated. But for the most part, the easiest way is to keep foods around you that are healthier to eat, keep environments around you that are healthier to live, and keep events around you that don't stress your body and your mind. That's the easiest thing to do.
Okay, so she
And
said
that's
C-reactive protein.
okay. Yes. I just wanted to be sure
Yeah,
because yeah, CRP is, and that is the medical acronym that we use. I
right.
just wanted to be sure that's what you meant. So CRP, C-reactive protein, is basically what our body does when it's under stress. It's a protein our body puts out in stressful situations. It's non-specific, but anytime there's any derangement of any process in our body, any inflammatory process, then it rises. Stress will make it go up. Um, Dehydration will make it go up. Blood clots will make it go up. Hypertension will make it go up. And so, if they're continuously rising levels, it's in and of itself, the CRP is not dangerous. It's the cause of it rising that can
Hmm.
be dangerous. And so, finding the cause. And so eliminating sugar, because sugar is one of those things that can cause inflammation, that can make it go up. Reducing stress. Stress is something that makes cortisol go up. Cortisol can make CRP go up. Making sure all your numbers are normal. If you're even mildly diabetic, get treated, get your numbers down to normal, and then do what you have to keep them there. If your thyroid isn't functioning properly, get it treated so that your numbers go to normal, because anything outside of normal, your body's going to be under stress, because your thyroid helps us stay, it helps our metabolism. And so it's really just finding all the things that stress you physically, mentally, and emotionally, and try to eliminate them.
So another question we have, the doctor tells you that you have pre-diabetes. How do you change your diet? What do you eliminate? What do you eat?
Okay. The way you change your diet is by upping your protein first. That's the easiest thing to do. When you tell people drop your carbs, carbs are comfort food. It's hard to do, but it's easier to add protein to what you're doing. So what I did, because I okay, do what I say, not what I do. So I like carbs. And so what I learned, actually, one of the things I learned when kind of putting together my program for myself, was that I didn't have to reduce my carbs so much if I increased my healthy fats and my protein. And so the best thing to do is make sure you have protein in every meal and snack, because that way it takes up the space that carbs would have been in. Because pre-diabetes is carbohydrates. I mean, it's caused worsened by carbohydrates. Now, depending on where you are, if you're pre-diabetic, more than likely you're walking around really tired, you're walking around with mood swings, you're walking around with your weight going up, and no matter what you do, it just won't come back down. You're walking around irritable a lot of times, or just feeling sluggish, feeling like you're not yourself. So my advice has always been, depending on where your level is, I treat during what is called pre-diabetes. Because when someone says, I'm trying to get healthy, I'm trying to lose weight, I'm trying to get my health together, trying to do that when pre-diabetic without all the tools is like building a house and being told, you have to build a house, but you can't use a hammer. Or it's like pushing a boulder up a hill all the time and then just hoping it doesn't slip and roll over you. So what I always say is, get treated, because then it makes all the other behaviors that you need to do to get it to go away suddenly become a whole lot easier, and you're more likely to reverse it. So better to go on medication temporarily and reverse it completely for the rest of your life, or constantly struggle and never get there. But for some people, they can. Now they can. And even my father, and I'm very proud of this. Well, he was from a very large family. He was the only male in his family to live past 60.
Mm.
Hypertension, high blood pressure, in their family, very, very rampant. We're from a family that if we take care of ourselves, we do well. If we don't take care of ourselves, we do very poorly. My mother married him and said she didn't want to be a young widow, so she slowly changed his habits. And he was actually on insulin at one point for diabetes. By the time he passed away when he was 90, he was on half a pill when he needed it.
Mm.
And that was simply from shifting from a high carbohydrate diet to a healthy protein, healthy fat diet, and plant based. Really, if you really, really, really want to just change your diet and change your health right now, when you look at your plate, half of it should be vegetables. The amount of carbohydrates should be no more than the palm size of your hand, and the size of the protein on that plate should be the size of your hand or larger. So it's always more than that carbohydrate. And in that combination, the carbohydrate will always be the least amount on your plate, and that will get you started.
So we have another question. I need to build muscle to support my bones and to burn fat. Is there a dietary change I need to make to support this?
Increase protein. When you don't eat enough protein, your body goes after your protein. I mean, goes after your muscle for that protein. So there's three things. So basically, there's three nutrients. There's what are called macronutrients. You've got your protein, you've got your fat, and you've got your carbohydrates. Now, carbohydrates are hard because your brain is your brain's drug, and when people say they're addicted, it's for real. Mm-hmm. It's true. Your brain just it's our brain's crack. I mean, it really is. And so as soon as we put it in our mouths, our brain gets ready for it. It's like, all right, here comes my drug. So eating protein and more protein first breaks that pattern. And so when you eat protein, your body will take that protein and make muscle out of it. If you eat carbohydrates, it will take it and either turn it into fuel or turn it into fat. And if you eat fat, your body actually turns fat, depending on the type, turns it into hormones. So fat doesn't make you as fat as carbohydrates will. And so if you want to maintain your muscle and you don't want your body going after your muscle for the protein it needs, eat more. Most of us don't eat enough protein. And so sometimes you have to supplement it with like protein shakes as well, because we just don't eat enough to get all the protein we need. However, there are some very packed foods that are packed with protein. The small beans are packed with protein. Soy is packed with protein, but you got to be careful with soy because of the estrogen. But that's still, most people don't eat enough for it to be an issue. Red meats are probably the least healthy source of protein. And however, they can be helpful if, it just depends on it really just depends on your diet and where you live and where you're from and what kind of food you like to eat. Because that's also very important. Changing your diet shouldn't mean changing your favorites or changing your preferences.
Right.
It just means upping the things that are healthy and decreasing the things that aren't.
Yeah, that's why it's a lifestyle. It's not a diet, it's a lifestyle, so that you can actually live like that. Because that's what scared me with the elimination diet I did, was that I cannot live like this. I can't live without carbs. Although I did make it a whole 2 months without them. I couldn't, I'm like, I can't really.
Really? Oof.
I know.
I can't even make it half a day.
I know. I was impressed. I went cold turkey and I couldn't believe it. I was really impressed with myself. I will never do it again. But and I mean, I was the person. I went to dinner and they ate and I didn't. And never will Wildfire that day decide to introduce, they had little cornbread muffins. I was like, and I sat there and watched. And I didn't eat a thing.
And they're really there are certain rules that I stick to that just make it easy, so I don't have to think about it.
Right.
It's like I just never eat a carb by itself. And so anytime I pick up a carb, my first thought is, what can I put with this to make it so that it's the least amount of what I'm eating? So, if good example, and again, do what I say, not what I do. But anyway, I wanted something sweet today, so I got an apple pie. Those little packet pies, and I was like, I wanted it, and I wanted it right then. But I was like, no, I was out, and I was on my way home because I was grocery shopping. I went by and I saw the little pie, and I was like, ooh, I want one, and I got it. But what I did is I came home, I drank a protein shake, I took some lunch meat, which I eat limitedly because of the salt, rolled it around some cheese, ate that, and then I had my apple pie. And then 45 minutes later, I checked my blood sugar just to be sure that it didn't go up. And it didn't. And so I'm like, okay, now I know how I can eat apple pie without it causing me a problem. And
That's
that's
good.
big. And so now that pie, because I ate it and I enjoyed it and I savored every bite of it, none of my stress hormones came out to turn it into fat, because that's what happens when you stress eat. And so eating when you're intentional, it doesn't have to just be what you eat, but also just sitting down, really letting all your senses take in the food so that
Yeah,
your
so
brain
not
gets
eating
the
in front of the
message.
TV and not eating
Yeah,
on
so
the
your
run.
brain get exactly, your brain gets the message. It smells it, it tastes it, it hears it, it feels it. And so your brain's like, okay, food is there. And so all those hormones that tell your body you've eaten, that you're full, that you can stop now, get activated. But if you're distracted, your brain's getting mixed messages, not knowing which way to go. Should it get you ready to run because you're moving, or should it get you ready to, you know, turn this into fuel because you need it? Should it? So it just confuses your brain when you're doing too many things while you're eating.
No, I will get off the phone so that I can eat and enjoy my food.
Oh yeah,
Like I can't talk and
yeah.
I need to enjoy every bite of this. And I intermittent fast, so I haven't eaten today. So when I go
Mm-hmm.
eat,
Oh,
I'm
good for
going
you,
to
because I
sit
can't do
down.
that either.
Huh? You couldn't do intermittent fasting?
I
You
like food
know,
too much.
I've been doing it for so long, it's not a big deal. It doesn't bother me.
Mm-hmm.
I don't miss food during the day.
Mm-hmm.
Um, and then I just eat like once I start, I don't stop until literally my head hits the pillow. I eat in bed. I tell everyone,
See, I that's a
and no,
pattern for
no
me
one
that
says
that would be
anything to
so
me.
unnatural. I couldn't do it. So I just wake up and eat, and then eat all day till my
Yeah,
pillow.
I wake up and I work out. That's like the biggest thing. I have to wake and work out. But
Mm-hmm.
folks are like, "You eat in bed?" I was like, "Yep, I have my bowl of oatmeal
Mm-hmm.
and then I'll have my golden grams." And they're like, "Are you
Mm-hmm.
serious?" I was like, "Yeah." And the other night, I had a bagel, a toasted bagel,
Mm-hmm.
and with some butter. And girl, I was happy as a lamb. I'm like,
Yeah. Now, see, with that, if I had a toasted bagel, what I would do is put nut butter on it, and then or have some cheese and lunch meat with it. Because for me, eating a toasted bagel, my blood sugar would just go shoop
okay,
right up. But
okay,
before we go on, I just realized that I was reading the comments
yeah.
and not reading the names, and I just want to say hello to my niece who asked a question, and I didn't even realize it was her who asked it. Hey, Farah, how are
I
you?
love it. I love it. I love it. And if any of
Yeah.
the Spartans are watching, it's two of us. We are both Spartans. And
Yes.
thank you because I posted it in our Spartan group. So
Oh,
I know
okay.
several of them were very interested in this conversation, and maybe you'll
Mhm.
get some Spartan clients. But thank you so much. Someone said I do intermittent fast. It really helps me keep my weight under control. Lillian,
Mhm.
see, I'm with you.
Yeah. No, it works. And now
Oh
it's.
yeah.
I'm not saying it does
No,
work,
no.
because
Yeah,
what
it
it
does
does, it
not for
affects
everyone.
that.
You got to know
Yeah,
which
that
for
it
you.
affects that cortisol, insulin, hormonal arc, especially if you're going through menopause or getting close to menopause. It really works very, very well. I personally don't have the discipline for it,
Right.
but other people, if you do, that's good. But I don't.
And then
I
I
just
keep telling everyone, when you feel like you're hungry, drink water. And then you might
yeah.
realize I really wasn't hungry. You just were thirsty.
Hmm. Well, that's one of the things I always recommend to anyone anyway, is always drink water before you put anything else in your mouth, because a lot of times your body misinterprets dehydration as hunger. And so you reach for something to eat when really what your body wants is fluids.
Yeah. But this has
Yeah.
been so enlightening. And I think that, and I know a couple people have said that this was great information. So
Thanks.
I am so glad that we did this. Thank you, everyone that watched. And then I know several people said they shared. Please, when you're watching the replay, feel free to keep sharing it because this is great information. Here's her website, drtoomer.com. Please, can you let people know how they can find you on social media?
You can find me on social media at on Facebook, C Harmon Toomer MD, and which I'm the only Catherine Harmon Toomer MD on Google. So if you put that in, you'll find me. But drtoomer.com kind of gives you all the place. It's all in
Oh,
one
perfect.
spot, so you can find me from there. But can I just say one thing,
Yeah,
just
go ahead.
because I know we were talking about heart health and weight loss? What I wanted to say very clearly is, if you have hypertension, if you have diabetes, if you have high cholesterol, that is a deadly combination. So do whatever you have to do to get those under control simply because they affect the blood vessels to your heart more than any, well, they just do those three more than anything else. And so, and I always say blood sugar makes the inside of your blood vessels rough. Cholesterol likes to stick to it, to block it. And then what blood pressure does, if you think about how pressure washing can strip paint off the side of a house, that's what it's doing to the inside of your vessels. So get your blood pressure down, get your sugars under control, get your cholesterol under control, and protect your heart. Protect everything, your eyes, your heart, your leg, kidneys, and everything. But since this is Heart Month and I'm wearing my red,
Aren't
I
you a
wanted to
Delta
just
too?
reiterate that. Yes, I am. I
Yes.
am a Delta. Yes.
That too. So Deltas, listen, one of your own. She's trying to help you out. And anyone in the Divine Nine, we really need to touch everyone because I know
Mhm.
everybody knows somebody who is on the verge of, or they're already on on blood pressure medication, or they're already
Mhm.
on diabetes medication, because that's just the way it is in our community. So,
And that's fine. There's
right.
nothing wrong with that.
But we need
There's
to
no
make sure
shame
that
in
we're
that.
doing what we can because we're
Hmm.
losing people way too early. I'm hearing about
Much
heart
too
attacks
early.
way too young.
Much too
We have
young.
to do what we can do because a lot of these,
Yes.
cancer, unfortunately, most cancers, we can't do anything about it. It just
Hmm.
came. Breast cancer is not
Hmm.
like there was something she could do. No, it just came. But
Yeah.
this is something you can do something about. You
Hmm.
can prevent this from happening to you and prevent your children from having to bury you early. So please, let's do what we
Hmm.
can.
Yes. And I just would like to say also, I am a community health and family medicine physician, and I know that working with me one on one can be beneficial for a lot of people, but also can be out of the cost. Can not, it's not always cost effective for most people. And so I do have other options like group programs, just because I just don't like say telling people no if they need help.
See,
I just can't do it. I
that's
can't do
the
it.
Spartan in her.
So
Spartans will. So we Spartans will help people. So
yes. So if I can't help you, I will find someone who can.
see? So everyone, please, like I said, share, 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 share. And
Yeah.
I will see you guys again next week at 6 o'clock Eastern, 5 o'clock Central, and 3 o'clock Pacific. Thanks again. Bye. Happy Valentine's Day,
Bye.
everyone.